Have you ever felt food get stuck when you're swallowing? Maybe a piece of meat or bread that just won't go down? Some people even end up in the emergency room for food that's completely lodged in their esophagus. It's terrifying. I'm Dr. Rajsree Nambudripad. I'm a gut health specialist, and in just the past month, I saw 2 patients with this exact issue. Both were diagnosed with eosinophilic esophagitis, also known as EoE, and both were told by their doctors to just take acid-blocking medications called proton pump inhibitors long-term. Neither were offered any food allergy testing, and neither were told that changing their diet could actually help control their symptoms. And that's what inspired me to make this video, to help spread awareness about this condition and how you can manage it using an integrative and functional medicine approach. So what is eosinophilic esophagitis, or EoE? Well, it's essentially an allergic condition of the esophagus, which is the tube that carries food from our mouth to our stomach. It's caused by chronic immune-driven inflammation where eosinophils, which are a type of allergy-related white blood cells, infiltrate the esophageal lining. This inflammation changes the motility in the esophagus and can lead to swelling, scarring, and even narrowing, known as strictures. One of the most common presenting symptoms is difficulty swallowing food and episodes of food impactions where food gets stuck in the esophagus. Many people have never even heard of this condition, yet the incidence is rising. In fact, because allergies are increasing across the board, it's no surprise that EoE is also becoming more common. Here are the common symptoms seen in EoE: difficulty swallowing, pain with swallowing, food impactions where food gets stuck in the esophagus, and acid reflux-like symptoms. In children, EoE can present with abdominal pain, vomiting, and failure to thrive. Some people even end up in the emergency room for food stuck in the esophagus. This may require an endoscopy to extract the stuck bolus of food. People with EoE often develop adaptive behaviors to help overcome their symptoms. This includes drinking large amounts of fluids with their meals, cutting food into very small pieces, excessive chewing, and taking much longer to finish their meals. Patients with EoE often avoid tougher foods like steak or swallowing tablets or pills, which they may find get stuck in their esophagus. So who gets eosinophilic esophagitis? Well, EoE has gone from being almost unknown in the 1990s to one of the most common esophageal disorders today. In the United States, it affects 1 in 700 people, so it was once thought to be rare, but now it's one of the fastest growing causes of swallowing problems. In children and young adults, it's actually the second most common cause of swallowing trouble after GERD, which is gastroesophageal reflux disease. EoE is more common in men and more common in wealthier developed countries where allergies are increasing overall. And importantly, EoE is strongly associated with the atopic triad, which is allergic rhinitis, also known as nasal allergies, eczema, and asthma. Also, people with EoE often have a family history of allergies. So what's causing the rising incidence in EoE? Well, modern lifestyle factors like antibiotics early in life, more C-sections, and disrupted gut microbiomes may be fueling the rise of allergies and EoE. EoE isn't just an isolated esophageal disease. It's part of a bigger story, the way our modern lifestyle is fueling allergies and reshaping our immune system. So how do we diagnose eosinophilic esophagitis? The gold standard for diagnosis is an upper endoscopy with biopsies taken from multiple areas of the esophagus. So you need over 6 biopsies taken from different levels of the esophagus. The definition of EoE is greater than 15 eosinophils per high-power field in the esophageal biopsy. In this pathology slide, the eosinophils are the pink cells. So if we find over 15 of these cells in a high-power field in a biopsy of the esophagus, that's how we make the diagnosis of EoE. For the results to be accurate, you need to be off of any acid-blocking medications like proton pump inhibitors for at least 2 to 4 weeks before the procedure. And that's because these medications could mask the inflammation in the esophagus. You also don't want to be on any type of elimination diet or restricted diet prior to the procedure. Now let's review some of the classic endoscopic findings seen in EoE. Esophageal rings are one of the hallmark findings of EoE. They're circular constrictions that look like rings in the esophagus. In fact, this is sometimes referred to as trachealization of the esophagus because it resembles a trachea, which is the windpipe that normally looks like this and has rings. In addition to the esophageal rings, EoE can also present with exudates, which are white plaques or pus-like spots, linear furrows, which are vertical creases along the esophagus, or stenosis and strictures, which are areas of narrowing. If left untreated, EoE can lead to permanent changes like scarring, fibrosis, and strictures that block the passage of food. Sometimes this requires endoscopic dilation, a procedure to physically stretch the narrowed esophagus. This is why early recognition and proper treatment are so critical. Often, EoE is misdiagnosed as simple acid reflux or GERD, which is gastroesophageal reflux disease. And in many cases, GERD can resemble EoE. In fact, acid reflux can sometimes cause a few eosinophils to show up on the esophageal biopsies. But in EoE, we see eosinophils higher up in the esophagus where acid doesn't reach, and in much higher numbers, defined as 15 or more per high-powered field. And that's how we distinguish EoE from GERD. Essentially, EoE is your body trying to send you a message. Certain foods are triggering an inflammatory response in the esophagus, and if we can identify and eliminate those foods, the symptoms often resolve. What's the alternative? Well, you could take medications to suppress the symptoms. Usually, the number one medical treatment is proton pump inhibitors, or PPIs, which are often used in high-dose twice-a-day dosing and long-term. The second medical treatment used in EoE is topical steroids, like fluticasone or budesonide. Interestingly, these are actually asthma inhalers, but instead of inhaling the medication, the patient is directed to swallow it. And in severe cases, EoE is treated with a powerful biologic medication called dupilumab that modulates the immune system, and is given by weekly subcutaneous injections. And this is the same drug that's used for severe asthma or eczema. But which approach would you prefer, suppressing the symptoms or addressing the root cause? The truth is that all medications have side effects. Let's talk about proton pump inhibitors, also known as PPIs. So they can be extremely helpful in certain situations, like in treating ulcers, severe reflux, or bleeding from the stomach. The problem is when they're used long-term with no clear endpoint, just as a way of masking symptoms. When used this way, PPIs can lead to their own set of health issues. By suppressing all the acid in your stomach, they can lead to a domino effect of downstream side effects. This includes nutrient deficiencies, including deficiencies in calcium, magnesium, B12 and iron, osteoporosis and fractures, chronic kidney disease, pneumonia, small intestine bacterial overgrowth, a big root cause of bloating and IBS, a C. diff infection in the colon, which can cause life-threatening diarrhea, and a study published in the Journal of Neurology is even showing an increased risk of dementia. Now let's talk about side effects of the second standard treatment, which is topical steroids. Budesonide or fluticasone are actually asthma medications that come in inhalers. But instead of inhaling these steroids, you swallow them. So in a sense, EoE is treated like asthma of the esophagus. And for younger children, they put the steroid in a slurry or suspension. Although steroids are quite effective at lowering inflammation, they do increase the risk of yeast overgrowth in the esophagus, which we call esophageal candidiasis. It's basically candida overgrowth in the esophagus. And on the tongue, we call this thrush. According to the 2025 guidelines by the American College of Gastroenterology, once EoE is diagnosed, there should be shared decision-making to determine if a patient wants to go through pharmacologic therapy or diet elimination treatment. So you should be able to talk to your doctor to determine which treatment path is best for you. Because if you're willing to change your diet, you may be able to avoid taking PPIs and steroids, especially long-term. Food allergies are one of the main root causes of EoE. The most common food allergies are wheat, dairy, eggs, soy, nuts, and seafood. This is why anyone diagnosed with EoE should be referred to an allergist for further testing. Sadly, of the two patients I saw recently, neither were referred to an allergist, and neither were offered any food allergy testing. Both were just told to take PPIs indefinitely. Allergy testing can be done in two ways, either through a skin test or through a blood test where we measure your IgE antibody levels towards specific foods. So I prefer IgE testing because it can pick up on very low-level allergies that could be missed on a skin test, and it's easier because it's a simple blood draw. Now, there is some controversy on whether skin testing or blood testing for allergies is accurate in predicting which foods to eliminate in EoE. And that's because the immune mechanism of EoE is a bit more complex than straightforward IgE food allergies. Here's a diagram showing the exact mechanism in how eosinophils get recruited in EoE. It's a T-cell mediated, delayed hypersensitivity reaction to food proteins. Food allergens trigger T helper cells to release cytokines called interleukins, which cause inflammation and recruit eosinophils that infiltrate the esophageal lining. Let's compare that to the pathophysiology of IgE food allergies. So a food allergen like a peanut causes IgE antibodies to activate mast cells to release histamines which cause immediate allergy symptoms such as hives, swelling, or even anaphylaxis. Now you might be wondering, do eosinophils play a role in food allergies? Well, in traditional IgE food allergies, eosinophils can be recruited later if the allergic reaction is severe or prolonged, especially in chronic allergic conditions like allergic rhinitis, eczema, or asthma. The bottom line is even if the pathophysiology of EoE is slightly different from that of IgE food allergies, eliminating food allergens can still make a huge difference in improving symptoms of EoE. So what does the research tell us about food elimination in EoE? Well, studies have shown that putting patients with EoE on elimination diets improves their symptoms. But the question is, what type of elimination diet is best? Well, here are the different types of elimination diets that have been studied. In the 6-food elimination diet, you avoid cow's milk, wheat, eggs, soy, nuts, and seafood. In the 4-food elimination diet, you avoid cow's milk, wheat, eggs, and soy. In the 2-food elimination diet, you avoid cow's milk and wheat. And in the 1-food elimination diet, you avoid just cow's milk. And finally, there's the targeted elimination diet, which is based on allergy testing. A review article published in the Clinical Journal of Gastroenterology and Hepatology in 2023 looked at over 34 studies and over 1,700 patients who went on elimination diets to manage their EoE. Over 900 were children and over 700 were adults. They looked at the different types of elimination diets: 6-food, 4-food, 1-food, and targeted elimination diets. And overall, they found the clinical response rate, meaning symptom improvement, was about 80%, which is excellent. And this chart is showing the rate of histological remission, meaning normal biopsies, and on average it was about 53%, which is also excellent. So what do I recommend for my patients? Well, I recommend the targeted elimination diet based on IgE food allergy testing. So one of my patients is a 60-year-old woman who was recently diagnosed with EoE. And this is what her basic allergy test looked like. She had allergies to egg white, peanuts, wheat, cow's milk, shrimp, and sesame seeds. The report also rates the severity of the allergies from class 0, meaning no allergy, up to class 6, which is the most severe form of allergy. Now, for severe allergies between class 4 to 6, the patient probably already knows that they have an allergy to that food, and they may have even had a prior episode of anaphylaxis. Now, in this case, her allergies were mild since they were only class 1 to 2. And you can see at the top that her total IgE is elevated at 237. And this reflects her total allergic burden from all her food and environmental exposures. So while this is really helpful, you can see that a basic allergy panel only tests for 15 foods, so it's a bit limited. So I like to have my patients make a list of all the foods that they eat commonly, and then we can test the IgE level to all of these foods. And this really helps prevent unnecessary food restrictions. Like, why avoid eggs, which are a really nutritious food, if you're not allergic to them? It's also important to know if you're allergic to your cooking oils. So if you cook with olive oil, you should check IgE to olive. If you use avocado oil, we should check IgE to avocado. And if you use coconut oil, we should check IgE to coconut. This is just a portion of the additional allergy testing we did for my patient, but as you can see, it's showing mild allergies to broccoli, lemon, turkey, rice, and chicken. I really find the IgE food allergy testing to be the most objective way to guide decision-making about food. Our first goal is to achieve clinical remission, meaning resolution of the symptoms. And at that point, we can start reintroducing foods one at a time, starting with some of the low-level class 1 allergies. Now, what about environmental allergies? Well, it's helpful to test for those as well, because studies have shown that environmental allergies may be a contributing factor in EoE. My patient was allergic to dust mites, olive trees, cats, dogs, and timothy grass. So although food is the main trigger in EoE, it can be helpful to minimize exposure to environmental allergens as well. Gut microbiome imbalances can definitely exacerbate symptoms in EoE. If your small intestine or colon is inflamed, or if you have leaky gut, this could increase your digestive symptoms. Also remember that 70% of your immune system is in the lining of your gut. So if your gut is inflamed, that could be adding gasoline to the inflammatory process happening in your esophagus. So quieting gut inflammation and restoring a healthy gut ecosystem is key to immune regulation in EoE. Healing your gut microbiome, the ecosystem of your gut, is crucial to reducing symptoms in EoE. And this is something that's not talked about very much. But the truth is that everything in your gut is interconnected. So if you have a bacterial imbalance in your gut called dysbiosis, this could have a domino effect and cause your EoE symptoms to worsen. Similarly, if you have low pancreatic enzymes or sluggish gallbladder function and can't digest your food properly, this could worsen your symptoms as well. Finally, if you have inflammation or leaky gut, that can actually worsen your food allergies and your reactions to food. So healing the ecosystem of your gut is a fundamental part of managing your EoE symptoms. And rather than guessing, my preference is to do a comprehensive gut microbiome test. That allows me to understand the unique microbiome of my patient, and then I can create a personalized protocol to help heal their gut. Now, going back to my patient with EoE, here's what her microbiome test looked like. Here's a summary showing that she had severe dysbiosis with a score of 10. She had maldigestion with high protein in the stool, and an overabundance of yeast and fungal organisms in her gut. This is where we can see in more detail that the protein in her stool was high. And high fecal protein could indicate low stomach acid. Imagine being treated with a PPI to shut down the acid in your stomach when your problem is actually low stomach acid. In this case, you actually want to treat this by taking digestive enzymes and betaine and pepsin. This will help you digest food better in general, and the betaine and pepsin is hydrochloric acid to really target the breakdown of proteins. Her stool culture showed an overgrowth of 3 bacteria, Citrobacter, Hafnia, and Klebsiella, and an overgrowth of a yeast called Candida glabrata. And all of this ties together because having low stomach acid is a big risk factor for getting dysbiosis and Candida overgrowth. Now, what else can we do to help improve her diet? Well, in addition to avoiding all the foods that were positive on her IgE food allergy test, I also recommend cutting out foods high in sugar and carbs due to the Candida overgrowth. Because remember, yeast loves to feed off of sugar. It's also helpful to eat a lot of dark leafy greens because these have anti-Candida properties. The vagus nerve is like the conductor of your digestive orchestra. It controls the waves of motility that move food down your esophagus and intestines, the production of salivary enzymes, stomach acid, pancreatic enzymes, and bile from the gallbladder. But under chronic stress, the vagus nerve goes offline. That means food isn't digested well, and your immune system is more likely to be activated. This is one reason why stress can directly worsen symptoms of EoE. Finding ways to calm your nervous system, especially before eating, is critical. For example, diaphragmatic breathing is a great way to activate the vagus nerve. Rather than eating on the go, you want to slow down and practice mindful eating. So you want to eat slowly, chew carefully, savor every bite, and don't eat when stressed. This will also help you to eat less and to avoid overeating. Another tip to help promote motility in your intestines is to practice meal spacing. So this means having 4 to 5 hours between meals and to avoid snacking. This helps the migrating motor complex, which are the waves of peristalsis, to clean out your small intestine between meals. And remember, everything in your gut is connected, so the better your small intestine is cleaning out, the better it is for your esophagus. Here are some of my favorite natural treatments when it comes to healing the gut and improving symptoms of EoE. Digestive Enzyme Pro targets the breakdown of proteins, fats, and carbohydrates, and you can take 1 to 2 capsules before or after your meals. In EoE, your immune system is reacting to foods, so the better you break down your foods, the less reactive your immune system will be. It can also help reduce symptoms of acid reflux and bloating. These are my 2 favorite supplements for healing inflammation in the gut. The first is IgG GERD, which is immunoglobulins that can work to bind several things that could be triggering inflammation in EoE, including food antigens, toxins, and bad microbes in the gut. And the second is L-glutamine powder, an amino acid that helps strengthen the intestinal lining. Both of these are excellent for healing leaky gut, which is critical to calming the immune response in EoE. Now, what about probiotics for EoE? I like to use a high-potency broad-spectrum probiotic like our Probiotic 100 billion, which has over 5 strains of lactobacillus and bifidobacterium, as well as Saccharomyces boulardii, which is actually a yeast probiotic and it can help protect against candida overgrowth. What about promoting motility in EoE? I like essential magnesium, which works as a natural osmotic laxative to promote bowel regularity, and motility activator, a natural prokinetic made from ginger that can help activate the waves of peristalsis throughout the GI tract, including the esophagus. And these are both best taken at bedtime. Now, what else can you take to help your immune system and lower inflammation in EoE? Well, vitamin D is a critical regulator of the immune system, so you want to optimize your vitamin D level to 60 to 80 on your labs, and usually this means taking 5,000 international units every day. I also recommend omega-3 fish oil, which are essential fatty acids to help lower inflammation throughout your body, including the esophagus. Having a condition like EoE can be stressful, and it can even provoke anxiety. That's why I recommend taking methyl B complex. This is the big stress vitamin that can help with anxiety and depression. It can improve focus, and it promotes a detox pathway in your cells called methylation. What can you do to quickly reduce symptoms if you're having a flare-up of EoE? The Elemental Diet is a hypoallergenic powder formula that you mix with water and drink to get all your nutritional needs. It's really easy on the gut because it doesn't require any digestion and it has no fiber. And all the nutrients are already broken down into the most basic building blocks. So you can drink it for a few days to do a weekend reset, and that can really help calm the inflammation in your esophagus. And it works because it gives your body all the nutrients that it needs while ensuring that you have zero exposure to your food allergens. Nobody should live in fear of choking every time they eat. If you've noticed food sticking or trouble swallowing, don't settle for just take a proton pump inhibitor long term. Ask your doctor if they've checked for eosinophils on your esophageal biopsy. Ask for food allergy testing. And most importantly, focus on healing your gut microbiome for better regulation of your immune system. I hope this video helps spread awareness that EoE has a root cause, and if you're looking for a more holistic and natural approach, definitely dig deeper into your food allergies so you can eliminate the right foods and work to heal your gut microbiome. Now I want to hear from you. Have you been diagnosed with EoE? Or do you know someone who should be checked for EoE? Well, please ask your questions in the comments below and share your stories. Thanks so much for watching.